Hi guys, I'm Dr. Rajat and today I'm going to be talking about root canal treatment. Now, to understand the procedure, you need to have some basic knowledge of the anatomy of teeth. A tooth is a hollow like our bones and is composed of several layers. The outermost layer above the gum line is called the enamel, which is the hardest and the most mineralized substances in the body. Under the enamel is the middle layer that is called dentine. The dentine is about as hard as bone. Beneath the dentine lies the innermost layer that is called the dental pulp. This is the soft inner mass of the tooth and is housed in a canal called the root canal. The pulp is needed to nourish the tooth during its growth and development. After a tooth is fully mature, the function of the pulp is to let us know if it is damaged or infected by transmitting pain. Now, due to various reasons, it becomes necessary for an endodontist to remove the infected pulp and clean out the root canals and fill that space with a sterile material to prevent further infection. This procedure is called endodontic therapy, or popularly known as a root canal treatment. Talking about the steps, an excess opening is made in the tooth to reach the root canals. The root canals are then shaped and cleaned to remove all the inflamed or decayed tissue. The root canals are then filled with a biocompatible material to prevent reinfection. The excess cavity is then restored with a composite resin, and occasionally a fiberglass post is used to aid in restoring the tooth. After a gap of 1 week, a cap is then placed onto the tooth to prevent it from fracturing. Microscopic assisted root canals helps visualize and magnifying structures up to 25 times their actual size. This allows for observation and treatment of problems which cannot be seen with the naked eye. I have been practicing microscopic endodontics since 2008, and the main advantages of using a microscope is unparalleled precision. It is minimally invasive, removes less tooth structure, allow us to see and treat root canal anatomy that is not visible to the naked eye, increase precision and predictability of the procedure, and the most important part is the documentation. The photographs of each steps of the root canal treatment can be taken and then emailed to the patient. Isn't it interesting? So if you have any information, if you have any query regarding a root canal, you can just let me know. And always opt for a smart choice, microscopic endodontics. See you soon. Cheers.